Good afternoon, everyone. Welcome to today's HIE office hour session. I am Jacqueline McDaniel, Community Engagement Manager at My Health, and I'll be your host for today's session. We'll give it just a few more minutes as folks trickle in from the waiting room. Okay. Once again, good afternoon, everyone, and welcome to today's HIE office hours session. I'm Jacqueline McDaniel, Community Engagement Manager at My Health, and I will be your host for today's session. So before we start, just a quick few reminders for everyone. First, panelists, please mute yourself when you are not actively speaking. Secondly, attendees are automatically muted in the webinar, so if you have a question, please feel free to use the Q&A or the chat function. Today's presentation will be sent out to all attendees after the session in PDF format. And additionally, the session is also being recorded, and so the recording will be available on our My Health website for you to revisit or to share with your colleagues. It's a quick reminder about two of our OK Shine programs offering major benefits for Oklahoma providers. The Connection Fee Assistance Program covers all one-time My Health Connection fees for organizations employing licensed providers in Oklahoma, making it easy and affordable to connect to the state-designated HIE. Additional related fees may also be covered, and applying is quick at okshine.gov. The Student Select program, Student Select Provider Incentive Program, offers up to 28% increase in reimbursements for qualifying care, 18.5% for Student Select participation, and an extra 5.25% for those sending data to the HIE. These are powerful opportunities to boost both care quality and financial return. Application links are in the chat and in the follow-up PDF. You can also visit My Health website for more information. But before we introduce our speakers and explore how LifeShare and the medical examiner's office are transforming their work through data, I really wanted to share two situations where access to information made all the difference or didn't. Imagine a wife rushing to the hospital because her husband has collapsed and is unresponsive. She knows he's a registered organ donor and wanted to give others a second chance at life. But the hospital couldn't access his full medical history. His records were scattered across several providers. And so without recent labs or clear medical history, the organ procurement team couldn't determine which organs were suitable. By the time some of the records arrived, only one organ could be used. Imagine another situation. A man was found deceased in a hotel room with no ID and no medical information. Investigators at the medical examiner's office have to manually call hospital after hospital, clinic after clinic, just to piece the information together. They wait days, even weeks, for faxes. Answers are delayed, and families are left in limbo. These stories reflect the limitations our systems face when the right information in the right hands at the right time is simply not available. Until My Health's partnership with these extraordinary organizations changed what's possible to carry out their missions. Today, LifeShare and the medical examiner's office are using real-time access to clinical data to act faster, more accurately, and with greater compassion. So now let's begin in welcoming our three speakers for today. Kim Gillespie is the Director of Hospital Development and Family Services at LifeShare Oklahoma. With over 10 years in organ and tissue donation, she leads efforts to strengthen hospital partnerships, support donor families, and improve donation outcomes through compassionate and strategic leadership. Lance Butler is the Director of Client Services at My Health, bringing over 20 years of experience in customer service, project management, and process improvement. Since joining My Health in 2018, he's led initiatives focused on social drivers of health and now oversees member engagement, recruitment, and communications. Samantha Richardson is the Supervisor of Investigations and Permits at the Oklahoma Office of the Chief Medical Examiner, Eastern Division. With a background in forensic science and criminal justice, she's been with OCME since 2011, working her way from permits to field investigations and now leadership. Sammy holds ABMDI fellow certification and brings deep expertise in medical legal death investigations. With that, Lance, I will hand it off to you.
Right. Thank you. And thank you everybody for joining today. As Jackie said, I am Lance Butler. I'm the Director of Client Services at My Health Access Network. I've been with My Health for a little over 7 years now, and kind of excited to share a kind of a high level vision of who we are and what we do, and kind of introduce today's topic to you. So, in 2009, healthcare leaders across Oklahoma came together around a shared concern. Clinical data was siloed and difficult to access, making care coordination a challenge. They knew we could and should do better. Their goal was clear: to improve care coordination, reduce provider burden, lower healthcare costs, and ultimately improve outcomes for patients. To meet this need, they created an independent nonprofit organization, eventually to be known as My Health Access Network, with a mission to improve the quality and value of healthcare and by enhancing access to health information. From day one, My Health is focused on empowering providers with tools and data that they need to deliver more coordinated and effective care and patient-centered care. Today, My Health connects more than 4,000 providers across the state of Oklahoma, with over 600 healthcare locations contributing data to the Health Information Exchange. The network supports care coordination for nearly 4 million Oklahomans, spanning a wide variety of services from primary care, behavioral health, public health, and even some non-traditional partners such as the organ donation services and medical examiner's office that we'll talk about today. A major driver of My Health's growth has really been our mission and our vision. In a recent employee survey, we asked our team what they valued most about working here at My Health, and the overwhelming answer that we received was our mission. And that purpose is something our entire organization really just stands behind. And it's really just driven My Health forward between our participants and our employees. So our mission is to achieve and sustain the highest quality healthcare at the best value in the nation by using health information resources, technology, and expertise. And our vision extends that even further to dramatically improve health outcomes and health care value for both individuals and entire communities. That mission and that vision has really guided everything we do at My Health. They inspire our participants and our employees alike to become champions of My Health. So while our outreach is often focused, more on the clinical benefits that has driven our growth at My Health, it's the passion of our people that continue to drive that adoption impact. So, for example, to see that passion firsthand, participants that referred LiveShare to My Health to say that they could access patient records more quickly, and to an employee of My Health who shared their work experience with an Uber driver, who later connected their team at the medical examiner office with My Health. So just that mission and vision and the passion that, again, everybody has behind My Health is really what drives us as an organization. But to really be clear, My Health itself is not the one who's transforming healthcare in Oklahoma. We're just simply a tool, like to be called a health data utility. We're just here to support those that are transforming healthcare in Oklahoma. Just like electricity or water, data is now really an essential utility for delivering high quality care, and we help make that data available. But it's the providers, the organizations, and the partners who really put in the work, who build the workflows around that data and apply that insight and create better outcomes for the patients and their clients. Today, we're excited to recognize two organizations. They've seen the value of this utility. They've done the hard work to integrate it into their workflows and make a real difference in the lives of the people they serve. And we're honored, really to highlight their efforts and share what's possible when data and dedication kind of come together. Because, at My Health, My Health at its core is a community-driven nonprofit, and our role is to provide those tools and the data and the support that helps drive better outcomes wherever and however care is delivered. So I will turn it over to Samantha and Kim to tell us a little bit about their organizations and what kind of drove them to join My Health.
Thank you, Lance. Thank you guys for joining today. My name is Kim Gillespie. So LifeShare, we are the federally designated organ procurement organization, OPO, that services the state of Oklahoma. So we cover every hospital in the state. And so our state border is our donor service area. And so we have to have a contract with every single hospital in the state of Oklahoma. And that includes a contract for the OPO, tissue bank, and then we also work with Lions Eye Bank. And we are supported also by a foundation. We have a foundation that supports the work that we do. We are also a nonprofit. And so we work with all hospitals across the state. And so if you can imagine trying to get electronic medical record access for all of those hospitals, over 140 hospitals, is very time consuming, keeping up with passwords, your data access, if you have someone leave, or if you have someone, a new employee that was hired. And so we saw that there was a My Health, there was this HIE access here in Oklahoma. And so we reached out to see if that was something we could partner with. And I'll talk a little bit about what that's done for our organization. But just to share a little bit about LifeShare, our vision is to be recognized as a sustainable global leader in saving lives and inspiring hope through innovation, inclusion, and compassion. And our core purpose is very simple. We save lives and inspire hope. And that's what our team tries to do every single day by meeting with families, working with hospitals to give people on that waiting list that second chance, that hope. Our business definition, we maximize the gift of donated organs and tissues, and My Health helps us do that by allowing us the access to the medical records so that we can maximize the gift for those donors or those families that have graciously given those gifts. We honor and support donors and their families. We promote donation through advocacy and education. In every hospital across the state, we do annual education and real-time education on case. They're helping promote donation, but then also helping support the hospital staff. We do drive progress through research and innovation. There are a lot of different innovation and research projects that we have going on right now. For example, we have a cancer program to where historically people could not donate organs if there was a cancer history. And now we work with a company to where we can do that. And so My Health allows us to have that access for medical records across the state wherever those patients are receiving their treatment. Our core values at LifeShare: can do, passionate, accountable, and adaptable. So that is what our team strives for every day, to have that can do, passionate attitude to help save lives and inspire hope across the state. And then our strategic anchors, what really anchor us to the work, are to embrace change, build relationships, and value people. And that's really what we try to do by helping these families, supporting these families, the donors, and then also the hospitals across the state.
Hi, everyone. Hope you're having a good afternoon. My name is Samantha Richardson. I am the investigation supervisor for the Eastern location of the medical examiner's office. I'm just going to start with a little bit of office overview. So we are a public health and safety organization. We are a state-funded agency. We came into existence in 1961, and for you true crime buffs out there, you can look into Nanny Doss. She kind of was the springboard for us becoming fully funded in 1967. We do have specific state statutes that dictate the type of cases that we should and shouldn't get involved in. Primarily, we're handling the sudden, unexpected, unexplained, suspicious, violent, unusual, unnatural type deaths. But we do also deal with a fair amount of unattended deaths. And that's simply people that don't have a primary care provider that they've seen in the last 90 days prior to their passing. So we do deal with a lot of those death certificates as well. We do have two primary office locations, one in Oklahoma City and one in Tulsa. We have in-house neuropathology, anthropology, toxicology, and histology. Our chief resides out of the Oklahoma City office, and our deputy chief is here in the Tulsa office. Our physicians, they are board certified forensic pathologists. So I think a lot of people often think of the term coroner and associate us to that, but we are different. We're not county-based, we are state-based. I have a team of medical legal death investigators who take death reports and determine our jurisdictional authority, and that is all reviewed by our forensic pathology team. They're the ones who are obviously conducting the exams if those need to occur. They also spend a fair amount of time dealing with testimony for legal proceedings, especially on homicides. We identify threats to public health, toxins, infectious agents, unsafe products. Very recently, we had a case come through that was visually apparent for meningitis. So that was kind of an inaction moment of catching a public health threat, because this person also came from a high-risk community. We work closely with other state agencies, the district attorney's office. We work closely with the health department for the death certificate processing, the local DAs who need us to come and testify, We use My Health for rapid data to make timely jurisdictional decisions so that a family or a reporting party isn't waiting for us to decide if a case needs to fall within our boundaries. And I'm going to give it back to Kim now.
Thank you, Sammy. So why we joined My Health. Again, I spoke about we have to have a contract with every hospital in the state of Oklahoma. We're federally designated. CMS and Joint Commission both require that. And so we have to work with every single hospital. And so this allows it to be a lot easier than trying to go out and get access at every single hospital to look up medical records. And especially if someone has an extensive history where they might have several different stays at different hospitals, different providers, different clinics. And so My Health brings it all together for us. It does give us that immediate access to clinical data for donor evaluation and organ matching. So within the hospital systems, there is a referral that is made. And so we have to evaluate every patient that comes through. Any death that happens in the state of Oklahoma in a hospital has to be called and referred to LifeShare. And so we work with My Health to be able to evaluate that patient in a timely manner. It does help us streamline that time sensitive process. As soon as that death occurs, time is ticking for when we can safely recover and match those gifts for transplant. So we use HIE. We have a clinical team of administrators on call that are available 24/7. We have what we call an approach coach or an authorization coach that helps navigate family dynamics. We have our DSCs, our donation service team, and they help run our communication center. So every call that comes into LifeShare goes through our communication center, and they all have access to HIE to be able to look up that information. Our quality team, so we work with different tissue processors and transplant centers across the nation. And so some of them need different information. Maybe it's something that we didn't have specifically to start that case or evaluate that case, but they need history for some sort of illness or something that is in the medical chart. And so we are able to look through that and provide those processors and transplant centers that information in a more timely way. Prior to HIE, there were times where we could not get the information to the tissue processor in a fast way, in a timely way. And so some tissue was unfortunately discarded. And same thing for the iBank. They have 72 hours where they have to get that information to in order to place corneas. And so we work very hard with the hospitals to have a good relationship, but HIE allows us to pull that information right then instead of having to call the hospital's medical records, get the information downloaded onto a disk, have somebody go physically pick up the disk and then upload the information. So HIE has really helped bridge that gap between us and our quality team and the tissue processors and transplant centers across the nation. We do coordinate in real time with care teams statewide. So there's about 35 organ potential hospitals in the state of Oklahoma where organ donation happens. And so we're able to coordinate in real time with those care teams. And again, it does reduce delays. It does reduce delays for our families, for organ allocation, but then also it reduces delays for those processors when they receive that tissue. It does accelerate our match cycle. So to match those organs and those gifts with a recipient, that doesn't just happen in Oklahoma. That happens again across the nation. And so it helps us to be able to match those gifts to a specific recipient and where it's going to be the best match so that that organ can function the best it can outside of the donor. It does allow us to have better clinical decision making and of course more lives saved through faster coordination. And so Sammy, I'll turn it to you.
All right. So yes, the big why we joined My Health. And I think it's important to kind of paint the picture of what we were dealing with before this. Oftentimes medical facilities don't just release information over the phone, right? HIPAA, all of these things that matter. So my medical investigation team, when they called to try to get information, we were often told we need a fax request before we can release anything to you. So kind of what Kim spoke to, the ability to be able to access information real time on decedents and make a jurisdictional decision without having to wait for another party to fulfill a medical records request was a game changer. A great example that I can give is, say someone passed away at home Friday evening, and they may or may not have a doctor. We're not sure. We can't get anyone to answer the phone after hours. Obviously, no one's going to be filling a fax request for probably the next 72 hours. So we're stuck in limbo. Do we take jurisdiction over a case that we may not need to and subject a family to our process, or do we put that decedent on hold until we can get that information the next business day? Neither of those were great solutions. So now that we can make these decisions, we don't have to do those things anymore. We gained access, I believe it was back in 2022. So we've been using the system for quite a long time now. We get better information for our forensic pathology team, which ultimately helps them determine more appropriate cause and manners of death. The records associated with the decedent with the exam done here is what's used to make that final determination for cause and manner. And if law enforcement's involved any of those investigative steps that need to be considered. We coordinate a lot with our reporting parties. So back to that home example, it's probably law enforcement that's calling in and reporting that death to us. And they obviously don't have access to any medical information. They're just gathering what they can on scene, whether that's from prescription bottles or a family member records laying around. So our ability to look somebody up and be able to see, are there other concerns? Did this person have a remote injury that they've had long-term complications from? Is there maybe drug or alcohol abuse that we are unaware of, or maybe even a family's unaware of, because that does happen. So overall, we're able to get a much more complete history to include what is the medical history, what medications are they on, what surgeries have they had. It also helps our doctors determine, do we need to do a full autopsy? Because not everyone needs a full autopsy. We can do an external, which is just photographs of the body, and then we run them through X-ray and CT here. We have both of those in-house. We have bedside drug testing, which of course is confirmed on the back end in the toxicology lab. So we have a lot more resources than we did before, and the health information exchange has just made the whole process and workflow here work so much better than it did before. So for us, the biggest key impact is definitely the improved turnaround time and the ability to serve the constituents of Oklahoma far better. I believe we're back to Kim now.
Thank you.
I'll steal it from you. So yeah. So to kind of give everybody a little more details on kind of how the HIE works, I'll give a really high level, how the data becomes available, where it moves between My Health, and then how we get it back out to organizations. So My Health receives near real-time clinical data from across the state, capturing approximately, I think we're receiving 85 to 90% of all care provided in Oklahoma at this time. This information, it's transmitted through data interfaces that we directly set up with each organization's electronic medical record system. And then once we receive that data, we perform patient matching, so to ensure that the patient's records are accurately linked across the system, so that John Doe that went to this hospital, Hospital A, is the same John Doe that went to Hospital B, and then we match all those records together. And then we make sure the data is available through a number of all of our products that we have available. So our primary tool that we have available is our provider portal. It's a secure web-based application that allows authorized users to search for patients that they're treating, and they have permission to view. And they view a comprehensive longitudinal health record. And the portal organizes the clinical data into really easy to navigate sections. So providers can quickly access vital information like labs and see it trended over time. As well as medications and vitals and encounters and et cetera, all in one location from across multiple sources. Beyond the portal, we also offer other tools that support, really proactive care, including notifications when patients are admitted to ERs or hospitals, tools that identify gaps in care, resources for screening social drivers of health, and several other features and products that help, provide help providers act early and be more effective with their care. Next slide. So as I mentioned earlier, when I kind of really went over the mission and vision for My Health is a neutral third-party nonprofit driven by our participants and really grounded in our mission or vision. But one of the most important reasons for our long-term success is the trust our participants have placed in us to manage their sensitive data. And that trust didn't really happen overnight. It didn't happen by accident. It's really built into the foundation of My Health from the very beginning. My Health established a really strong policies and technical framework that prioritize privacy, security, and the responsible use of the data. Access to data is role-based, meaning that users can only see the minimum information necessary based on their job duties and responsibilities. All participation is governed by a legally binding data use agreement, business associate agreement, and these agreements spell out exactly how data can be used and include clear and enforceable privacy protections for all the data. In addition, every time data is accessed, that action is logged and it's monitored. We conduct regular internal audits to ensure compliance with our policies and confirm that the data is being used properly and only for permitted purposes. And finally, My Health operates under a governance structure where we are guided by a diverse group of stakeholders from across the healthcare community. So if you're a participant in My Health, you have a seat at the table. So organizations just like LifeShare and the Office of the Chief Medical Examiner have a direct voice in shaping what our policies and priorities and oversight in My Health. And with all that in place, the robust legal protection, strong technical safeguards, and inclusive governance were able to provide reliable and trusted utility to our participants. And I believe Samantha and Kim had a few examples they wanted to dive into.
Yes, so if we can go to the next slide. So with LifeShare, this kind of shows for the first half of 2025, we have accessed over 4,900 patient charts. Monthly average about 832. So to give you a little bit of perspective, for organ donation cases, we start around 50 cases a month, and we have about 100 tissue donors a month. And so really this shows how many charts we have to look at and patients we have to evaluate. Something that is not truly known out in the general public is if you sign up to be an organ donor, that you'll be able to get to be one. But it's really only about 1 to 2% of deaths that occur in the state are eligible for donation. So there are a lot of referrals, a lot of deaths that come to us that we have to evaluate. And so if we're looking at an average of 832 charts and really only a fraction of those are able to be evaluated and then move on to be a donor. And so partnering with IHE and My Health really helps us to be able to look at that data in real time. So really kind of how the process works is a referral comes in when a patient is at the hospital, they meet certain health criteria. Maybe they've had a grave prognosis with the physician and they know the patient wouldn't want to live like this. And so that referral comes into LifeShare, and then we evaluate that. We look at it with the hospital, look at all past medical history. On every single donor, we have to get a social and medical history in order to move forward for tissue and organ donation. And so we're looking at everything, all their history. And so this really helps us to be able to look at it quickly and consistent usage. Another way that we use this that we didn't really anticipate when we first signed up with My Health is to find legal next of kin. So there are times when a family comes in, or when a patient, I'm sorry, comes into the hospital and that hospital doesn't have any legal next of kin contacts. So we use My Health to look at other hospital charts outside of the one hospital chart that they're in and be able to look at those contacts. And we've been able to help hospitals find legal next of kin so that they know their loved one is dying in the hospital or has already passed. So we've been able to really help connect those hospitals with legal next of kin through the My Health system. And then also it helps us to locate legal next of kin when we're wanting to talk to a family and that patient could be a candidate for donation, and we're able to have a conversation with that family if that's something that their loved one would want. And so that's something we really didn't anticipate is the legal next of kin and be able to connect those and help hospitals to be able to find that for those families. And so for tissue donation, every single death that happens in a hospital has to be called into LifeShare. And then again, we evaluate that through our communication center. They log into My Health and then look at all past medical history for that patient to see if it is something where we could move forward and talk to the family. The other thing is a area where My Health really helped us is there are times where we would get maybe a referral and the family was bedside ready to withdraw support. They were ready for their loved one to have a natural death. And so because of timing and our short time constraint, we would talk to that family and offer them the gift of donation. And then some families would be really excited about it. And it would really kind of give them hope that something good was going to come out of this tragic accident or something, this tragic death for their loved one. And then we would look in the chart and we would call other hospitals and start to dig. And then we would find that the patient was medically ruled out, that we would not be able to move forward for donation. And what that does for the family is it gives them that secondary loss to where they found hope in that meaning of donation and they found hope that their loved one would live on. And then we have to go back to that family and let them know, I'm so sorry. For whatever reason, your loved one is going to be ruled out and we will not be able to move forward. And so preventing that secondary loss and having access to these medical records in real time and be able to evaluate and assess so that we don't have to put families through that has truly been something that our team is so thankful for, just in the front line talking to those families and being able to offer what they know when they offer that opportunity to a family, they can be very upfront because it's not always something that happens, but they know that we've looked at the case and looked at the medical record and we have a strong background on that patient. So that real-time access really does help in evaluating for if we're able to move forward with that donor, but then also it helps with that coordination through those donor cases. So Sammy, I'll let you talk about yours.
Yes, so utilization. As you can see, we are very busy. So first half of the year, we accessed over 13,000 charts, and then our monthly average is about 2,200 charts. That includes the cases that we do take jurisdiction over and the ones that are reported to us that we do eventually release jurisdiction over. The importance of gathering that information, even when we release jurisdiction, is because there's another element to our office. State statute dictates that every person who's going to be cremated or transported out of state has to have a permit, and our office handles issuing those. So even though we may not take jurisdiction over a death by our statutory guidelines, we may end up still being responsible for that death certificate because a family has chosen cremation. So again, having that information in the system to have real-time, accurate health information allows us to certify a death certificate much more accurately than we may have before. We also are able to look up PCP records, especially again on our home deaths, so we can see, was that person seeing a primary care regularly? Were they prescribing their medications? Do they have reasonable conditions to have passed away? Which again helps us facilitate, do we need to actually take jurisdiction over someone or not? There's still many people not in the system. And that's just unfortunately a limitation to people not having doctors in Oklahoma. But that is something that hopefully will improve over time as more participants join. And kind of to circle back to what Kim said, another use that we didn't really consider until we were in the system is the ability to locate next of kin. There are many times that we have people that come through our office that, may have been witnessed to collapse on a sidewalk and taken to the ER, and the hospital doesn't have good information on who their loved one may be or their legal next of kin. And that allows us to kind of start that process, get them in contact with people, get us in contact with people so that we can ultimately get that decedent released back to their family for whatever disposition they choose.
All right. Key factors for success. So, I mean, I think this partnership has worked really well. The stories that Samantha and Kim have kind of gone over and how they're utilizing the health information exchange. But I really think, the reason that this partnership works well is because we're very aligned in some very fundamental ways. So each of our organization has shared today, and we're united with a shared mission. We want to improve outcome for patients and for families and have a broader public health system. So that alignment has been very powerful. And additionally, as we emphasized, My Health is simply really the utility, a tool designed to be flexible and adaptable. So each organization can integrate it into their own more unique workflows. But it's the work that organizations like this do that have thoughtful informations, they have daily use, and they have a commitment to quality care that really brings the utility to life and shows the true value that you can get from an HIE. Just as you shared just a while ago, once you got in the system, uh, finding next of kin was kind of a use case that they didn't know about. And so just really getting in there and understanding how they can utilize the HIE and create value out of it. Also, really kind of want to take a moment to recognize, the incredible partnership and communication that both of the teams have had and have they brought to the table. As I mentioned earlier, My Health has a really strong, policy and governance framework. So when both of these use cases came forward, it required for those to go through, a formal review process. So even though that these use cases, really felt like no-brainers, when somebody, hey, I need access to these records for these reasons, hey, that's almost a no-brainer, but they hadn't been approved use cases. We had to take those through our governance process to ensure they met those, high standards and the expectations of our participants. And so our governance model ensures, that every participant has a voice and a vote in how the data is used. And so, happy to say, obviously, that this use case, received a lot of strong support across the board and was approved. And that took a lot of back and forth, a lot of communication from both these teams, just to answer all the questions that they had to make sure everybody felt comfortable and had built that trust in how this data was going to be utilized. And so, lastly, I'll highlight the efforts of both teams, really do the onboarding and the training. Their teams have done a really exceptional job ensuring that My Health is in the hands of the right people. It's fully integrated into all the different workflows, and that the staff that need it are trained and are confident in how they use it. And in My Health, we're just here, for support and support that process any way that we can. I'm just grateful to be part of the success and the stories they tell. I can say that, day to day as an employee of My Health, most of us just really get locked down in the day-to-day operations and troubleshooting and whatever's going on, and be able to take a step back, hear these stories, and convey these to the team. It just really means a lot to the team to be able to take a step back and say, hey, connect it back to our mission, our vision, and we're actually, we're making progress. We're doing what we need to be doing. So before we open up to questions, I'll ask, Kim or Samantha, do you guys have anything to add?
No, I just appreciate the partnership, and it is great to see the aligned goals. And we work with a medical examiner a lot as well on our cases. We have to get approval for every single donation case. The medical examiner has to release on that. And so I just appreciate the partnership with both organizations. It's been great for LifeShare, and it's great to see all of the goals and everything aligned.
Yeah, I agree. I think this chart does a really good job at showing how they overlap and how we're all integrated and get the information that we need.
Awesome. I think, do we have any questions, Jackie?
Just one question for both Kim and Samantha. I think you both talked about some of the relationships have strengthened with like hospitals, those that you all work closely with. Can you talk more about like has interagency collaboration between the two of your organizations changed as a result or enhanced as a result of sort of this My Health being able to be part of the HIE?
Yeah, that's a great question. I will say that we we do have a medical examiner liaison that used to actually work for the ME. And so he handles that communication beautifully, and really helps our organizations really partner together to get the information that we need. Anything that the ME requests on any of our cases, he helps collaborate that. And of course, using My Health to get any information that they need to help support that. We want to make sure that we don't impede any kind of investigation, of course, that the ME needs to fulfill.
Yeah, we do have cases that, again, a homicide, for example, just because they have an injury doesn't mean that they can't still be available for the gift of life. So for all of us to be able to access that record, collaborate, figure out what limitations may exist on the exam side, if LifeShare goes first or if we go first, all of those things are worked out with the team. The liaison just called me in the middle of this presentation, so I'll have to call him back in a minute. But I think the last 3 or 4 years, there's been a vast improvement in our communication and our decline rate. I'm pretty sure last year we didn't decline a single case because we had all of the information that we needed at our fingertips. And if it wasn't there, we were able to ask LifeShare, hey, can you facilitate this with the hospital or whatever the case may be?
I think, Sammy, that's a great point. I think in like 2000, gosh, I don't know, like 17, 18, I think we had 19 declines from the ME, which was big for us. 19 times we had to go back to families and say, I'm sorry, we can't facilitate donation because we can't get the information. And so that's made a huge difference, for the lives that are being saved, of course, but then also for the families and for the hope that it brings them as well.
Wonderful, thank you. We don't have any other questions, so with that, we'll thank everyone for joining us today for this HIE office hour session, and we hope you find this information valuable. As a reminder, oops. Just as a reminder, you'll receive follow-up emails soon with a PDF copy of this presentation, along with additional information on upcoming HIE office hours and the opportunity to provide any feedback as well. So thank you again for your time and participation. If you have any further questions, please don't hesitate to reach out to us or today's speakers. You can find their contact information is right here. Have a great rest of the day, folks.
Thank you.
Thank you.